Welcome everyone. Today we're getting into the nitty-gritty of dental implant aftercare and healing, the kind of stuff that really makes or breaks your smile.
Sure thing. It's fascinating how simple habits can play such a big part, right?
Absolutely. It's like whether you have natural teeth or a shiny new implant, the basics really remain the same. You gotta brush, floss, and rinse every day, just with a little extra care.
And speaking of extra care, I've heard that patients are advised to steer clear of smoking and those hard, sticky foods during the healing period. Is that right?
Exactly right. Smoking is a huge no-no because it can seriously slow down the healing process. And those hard or sticky foods, they can really put a lot of pressure on the implant, which might jeopardize that delicate recovery phase.
It's kind of like handling a brand new gadget. You don't want to drop it or misuse it until it's fully set up, right?
Spot on. In fact, after getting an implant, the initial healing phase, especially for soft tissue, is roughly about 2 weeks. However, the bone integration, which is crucial for stability, can take between 3 to 6 months.
Yeah, that's quite a time span for the bone integration segment. Do you think that long wait could discourage some patients?
It might seem that way at first, but it's all about setting realistic expectations. Patients need to understand that while the gums may look healed in a couple of weeks, the bone, the actual foundation, is still bonding with the implant over several months.
Right, and that bonding is what ensures you have a strong lasting implant, isn't it?
Exactly. The process is quite gradual and is designed to, ensure long-term stability. And along with careful cleaning, it really emphasizes how proactive the patient needs to be during recovery.
Yep. Speaking of cleaning, there was a mention of rinsing. What kind of rinse are we talking about here? Is it just the regular mouthwash?
Great question. Patients are generally advised to gently rinse, often using a saline solution or an iodine-based rinse that helps keep the area clean without being too harsh.
Right. That makes sense because you wouldn't want something too strong irritating the healing tissues, would you?
Exactly. It's all about creating a nurturing, calm environment around the implant. Just like you would be careful with a new plant, ensuring it gets the perfect balance of care.
Yeah, I love that analogy. Just like a gardener who waters their plants just right, too much or too little, and it won't thrive.
Absolutely. That's a perfect way to put it. And it goes back to how the fundamentals of dental care remain consistent, even if you're dealing with an implant instead of natural teeth.
Now, one thing I'm curious about is just how strict the advice is regarding food. I mean, some might think skipping out on a favorite snack isn't a big deal, right?
I see that point, but the strictness is there for a reason. While some patients might feel it's a bit restrictive, it's really a temporary measure. Avoiding hard and sticky foods minimizes strain on the implant site and helps assure the best healing outcome.
I get that, but doesn't this temporary diet isolation make everyday social situations awkward for some? Like when you're at a party and you suddenly have to pass up your favorite treat?
I can see why you'd think that, and to an extent, it does require some adjustments, but view it as a short-term sacrifice for long-term gain, ensuring the implant lasts. Plus, with guidance from your dental professional, you can gradually reintroduce certain foods once the crucial healing period has passed.
True. It really is all about balancing immediate care with long-term benefits.
Exactly. Consistency is key. Your daily brushing, flossing, and gentle rinsing not only keep the area clean, but also support the natural healing process.
Yep. And these healing timelines, while they're set as a general guide, do you believe they hold true across the board? Or is there a lot of variation among individuals?
They're definitely guidelines rather than one-size-fits-all rules. Variables like overall health, age, and even oral hygiene habits can influence how quickly someone heals. But on average, you can expect soft tissue to recover in about 2 weeks and bone integration to take between 3 to 6 months.
Exactly. So, essentially, managing patient expectations is just as crucial as the physical aftercare itself.
Precisely. Clear communication between the dental professional and the patient really makes a difference. When people know what to expect, they're much more likely to follow through with a diligent aftercare routine.
And just to reflect on that, it seems like modern dental implants really embody a holistic approach, treating the implant almost like a living part of you that needs care and attention.
You've hit the nail on the head. It's like, while the implant is an advanced piece of dental technology, it still benefits from the simple, time-honored practices of good oral hygiene and thoughtful care.
Now, I do have a little challenge to that point. Some might argue that this aftercare routine is a bit too demanding for the average person, considering our busy lives. What are your thoughts on that?
I get that perspective, and it's a valid concern. However, once you integrate these routines into your daily habits, they become just another part of your lifestyle, not a burdensome task. And truly, it's a small price to pay for a lasting, healthy smile.
It really is like investing a little extra time now to avoid complications later.
Exactly. Think of it as preventative maintenance for your oral health. A little extra care now can prevent potential headaches down the line.
Yep. And coming back to the rinsing advice, it underscores that not every product out there is the perfect choice after an implant. The gentler, more thoughtful options really make a difference, don't they?
Absolutely. A regular mouthwash might sometimes be too harsh. The recommended solutions are chosen specifically to not irritate the delicate healing tissues, ensuring you create an ideal healing environment.
Yeah, in a way, it's almost like cultivating a new beginning for your smile. It's careful, methodical, and ultimately rewarding.
Spot on. And just remember, while the soft tissue heals relatively quickly in about 2 weeks, the full integration of the implant with the jawbone is a process that unfolds over several months. Patience really is a virtue in this process.
It's impressive how this entire process weaves together daily habits with the body's natural timeline. It really speaks to the blend of art and science in dental care.
Exactly. The aftercare is as much an art as it is a science, ensuring that while you're actively caring for your implant, you're also giving your body the time it needs to do its job.
Right. All in all, this discussion really underscores how critical dedicated aftercare is to the success of dental implants. It gives patients both a clear roadmap and the reassurance that, yes, a little patience and consistent care goes a long way.
Certainly, it's about really investing in your smile long term. With the right care, brushing, flossing, gentle rinsing, and avoiding harmful habits like smoking or risky foods, you can ensure that your implant and thus your overall oral health remains robust.
Yep. Thanks for this detailed dive. I feel like anyone listening now has a much clearer view of what to expect and how to handle implant recovery.
Exactly. Here's to proactive patients embracing these practices and enjoying a truly lasting, confident smile.